A stroke is simply a damage to the brain, and a stroke can be caused from a lot of different things. You can have a ruptured blood vessel in the brain that can give you a stroke. That's called a subarachnoid hemorrhage. You can have a ruptured vein that bleeds in the brain. That's called a subdural hemorrhage. And those are pretty rare, but they do happen. You can close a blood vessel inside the brain in a certain area and give you a stroke from an intracranial thrombosis. You can also have a bleed into the brain. That's called an intracranial hemorrhage. By far and away, about 70 to 80% of all strokes are caused from the carotid bifurcation. That is, plaque forms at the bifurcation of the carotid artery, where one branch goes to your face, one branch goes to your brain. It's where you get plaque formation. That plaque formation either closes the artery off completely, or the plaque formation breaks off little bits of cholesterol and plaque and platelets and fibrotic debris or thrombus, and it goes flying off up into the brain and gives you a stroke. The carotid artery is responsible for probably 70 to 80% of all strokes. The main way to prevent a stroke is to watch your diet, lower the amount of salt and the fats in your blood. If you have diabetes, keep the diabetes under good control. If you have hypertension, keep your blood pressure under control. If you have hyperlipidemia, keep your cholesterol under control. All those things are risk factors for stroke. Even if you have none of those, I recommend that adults take a baby aspirin a day, just a coated 81 milligram baby aspirin as a prevention of stroke or blockage of the arteries anywhere. Before you take any medication, especially aspirin, you should consult with your primary care physician just to be sure it's safe for you to take aspirin. If there's a family history of stroke, you certainly should be evaluated at an earlier age, maybe 50. Otherwise, everybody should probably have a screening test when they reach Medicare age, because when you reach Medicare age, you can have a screening for an abdominal aneurysm, and you can have a stroke screening, which is simply a carotid Doppler. That's part of the screening that's done when you hit Medicare age. So even if you have no history of stroke in your family, you should have that screening done anyway when you get Medicare age 60, 65.